Hello, I'm Dr. Obey, and this is A Moment in Medicine. Our focus is health, education, and wellness. Our goal is for each and every one of us to have that opportunity to grow old. To grow old in good health. Welcome to our show. Well, again, we're here and we have a great topic for you tonight. But before we get into our main topic, I would like to talk about sharing and caring. Remember, those episodes that I call med moments, a little chest pain or a little knee pain or that headache that just won't go away. Don't ignore it. Either go to your doctor or let someone else know about it because they may direct you to proper medical care or go to your doctor so you can take care of this. Do not ignore your symptoms. Remember also, you can contact us at OBHealthy.com. That's our website. And on that website, boy, there are all kinds of medical tips. So OBHealthy.com and Facebook. Obey Your Doctor. We give medical tips on that as too. Come and read the timeline. You'll be surprised. The medical tips just may help. Okay, let's talk just for a minute. I want to talk about obstructive sleep apnea and what it is. Obstructive sleep apnea is a disease that let me explain apnea. Apnea is when you actually cut off your breathing while you're sleeping. And when you stop breathing while you're sleeping, what happens is the oxygen actually goes very, very low. If this occurs over years or over a long period of time, it can hurt the heart. And in hurting the heart, it causes something called pulmonary hypertension. Pulmonary hypertension is high blood pressure in the lung system itself, not general high blood pressure. This is specific high blood pressure only for the lungs. And in that, what happens is your oxygen in your bloodstream then goes down, and it stays down because you've injured the tissues of the lung, and you've injured the heart as well. So obstructive sleep apnea is very important. If you're snoring at nighttime, that's normal. But if you're snoring and you stop breathing, that's abnormal. See your doctor. You need a sleep study, obstructive sleep apnea. Well, our topic for tonight is systemic lupus erythematosus, or SLE. And it's basically, you may have heard the word lupus. Lupus, many patients out there have lupus, and I think it's a topic that we really need to cover in depth. I have the perfect person to cover this topic. She's a rheumatologist, or someone who specializes in arthritis and things like scleroderma and lupus, really tough diseases, but she's an expert in it. Her name is Dr. Wen Xiong. Dr. Xiong, welcome to our show.
Thank you for inviting me.
All righty. So I'm so glad that you could come, and I know your schedule is busy, but I'm so glad you came today so that we could cover this topic because I have patients that have lupus, and I know how difficult the disease is, and we need to explain some of the things about it, and especially those patients that may have it and not know they have it so that they can get to their doctor. First question, my usual question is, what is lupus?
So lupus is commonly we call it a chronic disease, meaning it lasts for many years and weeks and years and affecting their immune system. Some problem with the immune system.
Right.
And the immune system is supposed to protect your body, but in this situation, it attacks our own body in our tissues, causing a lot of damages.
Right.
That's right.
Now let's step back because you said a few words that I want to clarify. Immune system. When we talk about the immune system, is that the system that actually cells in our body would go out and attack like bacteria or viruses or things like that if we got sick?
Yes, and not only the viruses, bacteria, and also like even the cancer cells. Like if the body something wrong with if like a cancer, there's immune cells actually going to eat those cancer cells to repair the body. So it's almost also the not only just defense our body, it's also the repairing our body. So that's very, very important.
Well, and now also, these cells, you say that these particular cells that are supposed to help our body, with lupus, they attack our body. What parts of the cells or what parts of the body does it attack?
So we call this overactive immune cells. So immune cells are supposed to protect in some situation, in some trigger points, the triggers those immune cells to become very active. We call it overactive.
Right.
When they become overactive because some reason, they start to attack our body.
Okay,
So that's
okay.
causing the lupus here.
Okay.
Right.
Now, talk about the cells that we're talking about. We're talking about like white blood cells, or are we talking about antibodies? Like antibodies, everybody's heard about the antibodies. Oh, those antibodies going to eat that bacteria up. Oh, those antibodies. Are those the cells that we are talking about that attack us?
Yeah, mostly is in white blood cells.
White blood cells. Mm-hmm.
And some specific white blood cells produce their antibodies produce some proteins called antibodies
Right.
that would protect us. But then sometimes when they produce their autoantibodies, those autoantibodies become harmful to our body. That's attack to the body. That's where we're called. That's why you hear a lot of words like autoantibody.
Yeah.
That's what attacks the cells.
So autoantibodies, that means they're working on their own.
Yes.
So autoantibodies. So antibodies help us. The autoantibodies go against us.
Yes, so
Okay.
Autoantibody does not tell what's the difference between the foreign invaders like a virus and their bacteria or cancer cell or our own healthy cells.
Right.
They attack everything.
They attack everything.
So that's the autoantibodies, which is harmful.
Right. Now, when they attack our body, what happens? Is it that things like inflammation and swelling comes about? What exactly happens to the tissues when these autoantibodies attack us?
When the autoantibodies start to attack the tissue, it does cause they release the chemicals.
Or release the chemicals into us.
Into the bloodstream or into our system.
Right.
And then when they release the chemicals, we call the cytokines. Those chemicals then induce the inflammation, which is the swelling, and also the pain, and also the damage of all the tissues get damaged.
So this substance that it releases, it actually breaks down. It actually causes damage to the tissue itself.
Yes.
And a lot of pain itself.
Because the cytokine, when it's actually those chemicals, it's become like snowballs. They become more and more and more, and it's out of control. When it's out of control, it causes too much inflammation, too much damage. That's what causes a lot of damage to the tissues. Right. Okay. When it's out of control. Right, so there's no good signal. Our body, for some reason, is not very good signal or regulation system to actually control those chemicals. That's become a problem. That's what happened in lupus.
Okay, is it lifelong? Can you like get it this year and like in a couple weeks or a couple months it's gone and you'll never see it again, or you once you have it you always have it?
So everybody is very different. So most people would have this for many years.
Okay.
But some people after many years and after a certain age, the disease can be actually, we call it remission, meaning the disease actually disappeared. We call it remission. It happens. But most people would have this condition for many years.
Okay, so most of the time, if you have lupus, it's going to be active for the most part.
It's probably not always active. It's waxing and waning. Waxing and waning. So
Okay.
sometimes you feel very good. Sometimes you feel like we call it a flare, and you feel very sick.
Okay.
So that's a flare. So and then we don't know when it happens. So that's
All right.
So it's not always active. So
Okay. What about age? Is there a certain age that lupus is more prevalent? Is it in babies or is it in seniors? When does it come about most of the time?
most commonly in the childbearing age, from 15 to 44 years old.
Oh,
so mostly in a woman. Is 90% of the patient with lupus actually in woman, a woman, right? Only less than 10% is men.
Is in men.
Right.
Okay, so most of the time it's women that can have this problem.
Right.
All righty, all right. And do we know what causes lupus?
We don't know what exactly causes the lupus, but we do know some certain fact actually has more. You tend to get the lupus. There's some certain factors could give you a higher risk to get the lupus. Yes.
Mm-hmm, mm-hmm. What about race? Is it more common in blacks or is it more common in whites? Well, how does race play into this?
It definitely is more common in non-whites and Asian and African American, and there are also the Spanish-speaking population. They are all 2 or 3 times more common than the white people.
Oh, so
right.
So the non-white, or just about all non-white races are 2 to 3 times more common to get lupus than whites. boy, oh boy. And you were talking about, well, I should ask you about genetic factor. If your mother or your father or sister or brother has it, are you more likely to get lupus at some point in your life?
It's possible, but it's not definitely.
Okay.
So it doesn't pass. The disease itself, meaning lupus itself, does not pass down from father to the child directly, but some certain genes, they can pass on to you. Those genes put you on a higher risk to develop the lupus. It's like other conditions, like diabetes, hypertension. If your parents have the diabetes, and then you may have the diabetes, but not always going to have it. It's the same situation.
Okay,
Right.
all righty. And I understand that there may be certain things in the environment that we may be, because they don't know exactly what causes it, they think that there may be things that we come in contact in the environment that may be causing it. Is that a thought?
Yes, we do know there's some certain infection like viruses. If you contact some viruses, and then that may actually give your immediate risk and trigger the people who get their lupus when they have some specific genes. So there's also very stressful if the body under a lot of stress and extremely weather changes, very cold weather, very hot weathers. And also if you take some certain medication, that's all can put you on a risk to get this.
So certain
Right.
medications can give you lupus.
Yes, that's absolutely right. So we're very cautious. We almost take a look at the patient list, what medication, what you're taking, then we can actually pinpoint to tell them some medication may put you on a risk to develop lupus.
Develop lupus. Not that the medication gave you lupus, but it puts you in that category that lupus would present itself.
Yes.
If you associate it with this, if you're taking this medication.
Some medication will cause, we call the lupus-like symptoms, may not cause the lupus itself. Some few medications actually can cause just like a lupus.
It's lupus-like, so it's not quite lupus, but it's the same symptoms of lupus.
Right, similar symptoms, but it's not as severe, right?
I got you. What parts of the body if you have lupus, what parts of the body should you be concerned about that may be affected, that may be harmed?
Any part of the body would be affected virtually. So most commonly, like a skin, you can get a rash, and most people will complain about pain in the joints and or the muscle pains, and also people and then any part of inside the body, like organs, like kidneys, lungs, heart, or blood system, those all can get affected.
All of those,
right?
Huh?
All of this.
So all of them can have serious, like if it affects the lung, then I could get short of breath.
Yes.
Or if it affects my kidneys, do it ever come to the point where the patient needs dialysis?
Yes, that's true. Yeah, it's actually in the first 3 years after diagnosis of lupus, that's a very crucial time. Is put you on a higher risk to have the kidney problems. So we actually watch very closely for those patients who has newly diagnosed lupus to monitor the kidney function, because that's the most critical time to monitor their involvement of a kidney.
Right.
Because if we lose those critical times, sometimes it's too late to treat, and the people get to the dialysis.
Right,
That's very sad.
Now, I understand you said it can happen all over the body. What about the brain? Can it affect the brain as well?
Yes, of course, the brain, and they can cause a variety of symptoms. Even most common symptoms just headache, like a migraine headache. It's most common symptoms they could have for people who has lupus, and other symptoms like a seizure. And then people can have their even this we call a psychosis, meaning they get wild and they can become like a very wild, and almost like the people has to go to their psychiatric units for that. That's and other things, people can be just in a coma suddenly. So that's any from mild symptom like a headache, or in a very serious symptom, just like coma. So that's
now, is that because the lupus, because of everything that's going on with lupus, is swelling in the brain? Is that the reason?
Some part of is the most and is swollen. Yeah, most time it's swollen of the brain.
So just like it may swell the joint up, or your knee, or your elbow, or you know what I mean, or the tissues of your arm, it swells the brain as well.
Yes.
Oh my goodness. All right then. Okay. And you said skin. Is there any particular type of, like I know that I was reading something that the face gets a certain type of rash. What's with this rash that associated with lupus? Tell me about this.
So a lot of time is we call the butterfly like rash. It's like a butterfly right over the cheeks. So, and we can see that very often.
Oh, okay.
And then other rash is just the raised patches, like a red patches,
Right.
raised in the arm. It's very itchy. Sometimes when you touch it, it's very, a little bit pain. So that's and that's very common too. Other rashes we call the discoid rash. It's just those rashes coming to the ear, earlobe, and also coming to the face. When initially was raised, and then a little bit roughly smooth, not smoothing, is really roughly touching, and after that it can leave the scar tissue. That when it leave a scarring, that's we call it, some call it discoid lesion. Discoid lupus, right.
Can you lose your hair with lupus? Somebody with, I think I saw some patients that were losing their hair. Is that part of lupus as well?
It's actually very common to have the hair loss in patient who has lupus, and because inflammation of the scalp.
So swelling of around where the hair is growing out.
Right, where the hairs are grown out, and then destroy the root of the hair. Then they can actually, then you can see all the hair loss and the patches of hair loss. You can see the piece of the bald hair and bald spot in your scalp. That's very common to see with this lupus with the hair loss.
You mentioned this butterfly rash. I did have a patient that came in with the butterfly, and it's actually very red on the cheeks, but it spares the nose, I understand.
So if the butterfly rash is crossed if this actually also involve the nasal fold right underneath the nose, usually it's different. It's not the lupus rash. It's a different rash. So we call the dermatologist sometimes refer that to called rosacea. So it's two different butterfly rash. So sometimes you really have to see the doctor to see it is lupus rash or it's not lupus rash. So it's different.
Okay, alrighty. What about as far as, is this disease predictable? You understand what I'm saying? If someone gets it, you can kind of predict how they're going to go. Is it an unpredictable type of disease?
It's unpredictable.
Really?
We don't know who's going to get it and who's going to get better. We don't know.
Even though you treat the patient, even though you give the medications, the patient still may not get better?
We do know if patient they're really if they know their disease better, and if they follow up with their treatment and follow up their monitor and everything, those people tends to get better.
Right.
And if the patient they're not really follow up with the doctor and not getting the right treatment and not monitor everything, they tend to get a lot of complications. And when they get complications, it's too late. Sometimes it's too late to treat. Then you see people they actually can die from their complications.
You mean you can really die from lupus?
Mostly it's the complications from lupus, because lupus involves the heart, and then it can cause their heart attack. Their inflammation, their swelling of the blood vessel from lupus can block the blood vessels to the heart. Then young people with lupus can die from heart attack. It's much more common than the normal population because of this condition. Yes.
Interesting. So the swelling is so pervasive in so many places that even the vessels of the heart can get swollen where the blood won't go through.
Yes.
So the oxygen does not go to the heart muscle, and young people can have heart attacks.
Right. So their incidence, the chance is actually much higher if the lupus is not well controlled.
Interesting.
Right. If their lupus is controlled very well, the chance is much less.
Okay. In your practice, in your office, how do most lupus, if somebody comes in and you see this particular patient and you start talking to them and you say, that may be lupus, how do they present?
It's hard to really, put them in their categories like that, because they can be any type, and because they're very different from the individual.
Right.
They can be very mild, they can be severe, but when someone who's a young woman comes in complain a lot of pain in their joints, in their arms, legs, fingers, and with some rash, like some red rashes, and in their right age group, that might put me, I need to check for her lupus.
Okay, alrighty. Now, you're talking about the muscles. I know that it affects the muscles. Does it affect the strength of the muscles, or does it affect are you stiff in the morning, or what effects does it have on your muscles? Do they get smaller from disuse? How does it affect the muscles?
Usually just their pain. Just the pain, like aching pain in the muscles and arms and legs, and then sometimes the cramping. And normally, usually doesn't have any, they don't feel like any weakness, anything. So it's just the pain.
Just the pain.
Yeah.
Alrighty. And what about as far as, I know that it causes arthritis, and we've been talking about the big joints, but are there any, like the knees, but is there any other joints that are affected by lupus?
So we'll see the hands, fingers, and also the ankle, knees. That's mostly commonly you want to see. And then other joints probably less often. The hands and the rest is very often. You can have the complaining about those pain. Yes.
About that pain. Okay. Excellent. Excellent. Now, we were talking about the heart as far as heart attacks. I know there are other things that can occur with the heart. And if it's an infection, see, the heart sits in a sac. I understand that. So what about does it cause fluid around the heart sometime, or can it cause inflammation around the heart, in the heart muscle itself?
Both. So, and it can get the inflammation, I mean the swollen and around the heart to cause a lot of fluid around the heart. And so, and then also cause the inflammation in the muscles and the heart muscle of the heart. So, but more commonly, maybe it's then it give the fluid around the heart. So then you can feel a lot of very short of breath and also chest pain. Right, a lot of chest pain, yes.
So it makes you short of breath when your fluid become around the heart.
Right.
What is it that the heart can't, the muscle is not able to pump and go in and out because the fluid compresses on it or something?
Yes, the heart become very stiff to expand itself, then it's become very under a lot of stress, so that's why it's get a lot of short of breath, because the heart cannot expand itself when they try to expand.
Interesting.
Right.
What about the kidneys? Now, this is such an interesting problem, interesting disease, because it affects so many things. The kidneys, you know, they're vital to us, but do some patients have to go on dialysis? Is it that bad?
The swelling of the kidney was so much, so the kidneys not able to grab their protein from the blood, and then all the proteins can leak from the kidney out of the urine when we don't have enough protein in the blood, and then that's when they have a lot of problems. So then, and the blood risk become a lot of blood pressure, and people has a very high blood pressures, and people can have like a lot of problems. Then the people, and then with this, when they get severe, and then their kidneys become, when they after a lot of swelling, then it becomes shrink, and when it shrink, then that's when you need a dialysis, because it's not going to function anymore.
Interesting.
Right.
So initially the kidneys swell,
right,
and then they start not functioning well, and then they shrink.
Then there was like a scar tissue build up after the swelling, and then when it become a lot of scar tissue, then it shrink. And then they don't function. There's lose the function, that don't work well, and then that's when the patient needs dialysis.
Needs dialysis. Alrighty. Now, there are certain patients I know that you have to worry about blood clotting as well with lupus. Tell us about that. Why does your blood clot faster with certain lupus problems?
So there are up to 30% of patients with lupus have a little bit more risk to develop blood clot, because we call it specific autoantibody. So lupus patients have a lot of variety of autoantibody to attack different part of the body. So this specific autoantibody, that we call this antiphospholipid antibody, that has tendency to give you blood clot. So with that, if the patient with lupus has this antibody, then they have much higher risk to have a clot. So that's why, and then we have to check that to make sure, to ask them whether they have blood clot. If they do have blood clot, then we're going to put the medication for them, blood thinner, to prevent, for the blood clot.
So one of those autoantibodies is, it's antiphospholipid antibody.
Yes.
Boy, that's a big word.
Right.
Oh my goodness. And if I do the test and you have this, I know that there's a good chance sometime in your lifetime you're going to get a big clot. A clot in your leg, or a clot in your lung, or some type of clot somewhere.
Right.
And so we have to give you medication to prevent these clots from happening.
Yes.
Okay.
So if you never had a clot, but you do have this antibody, sometimes we may not need to give you the blood thinner. We may just take precautions. So, and sometimes take a aspirin to see that may help you prevent getting the damage from a blood clot.
Interesting. What about fever? Now, I know fever is a big issue with lupus, because you never know what the fever is from. So do you really take it seriously when somebody comes in with a fever and they have lupus?
Yes, we do. So fever can be very non-specific, meaning it can from if you have got infection from pneumonia, or if you got infection from some other things. And also fever can be just a symptom of lupus. So when people come in with a fever, we have to really make sure whether you have infection or you have the lupus, because the treatment for these two conditions is very opposite.
Right. Interesting. So the fact that that it can be dangerous if you don't treat right away, meaning that the infection can be overwhelming.
Right.
Right.
The fever is part of process of the inflammation, which is a flare of this condition. If we don't stop the fever, sometimes the flares can go on, and then can cause more damage to the body.
Okay, we have about 30 seconds. Diagnosis. Is it mostly you do lab tests to try to diagnose lupus?
So in lab tests with symptoms and physical examination, everything together, we put all the things together, then we can diagnose it, not just from lab tests.
Not just from lab tests.
Right, lab tests give us very good clue, but it's not confirmative event. Right.
So you would look at the rash, you would look at the joint pains, you would look at whether there's scarring on the lung, whether the kidney function, all those things put together would tell you about lupus.
Yes.
Okay, all right. Well, I'm telling you, I'm so happy that you came in and explained lupus for us. And we will have to get you back to talk about another rheumatological, I like that word, disease, okay? Thank you very much for coming on the show.
Thank you very much. Thank you.
All righty. Well, in closing, remember, sharing and caring. Remember, if you have any problems out there that you think may be medically related, go see your doctor. Go see your doctor, because you just may need that advice as to how to make you feel better. All righty. Now, remember, go to our website, obeyyourdoctor.com. All types of information on there. All information about medicine and medications, health tips, all that stuff. Listen, and Facebook, hook me up on Facebook, Obey Your Doctor. We'd love to see you come on Facebook and give me a tweet, or give me Twitter. We're on Twitter too, so you can give me a tweet, you can hook me up on Facebook. Never institute any change in your medical care until you consult your doctor. I trust each and every one of you continue good care, good health. Until next time, I'm Dr. Omar Bey, and this is A Moment in Medicine. Peace to you all.